Have you guys heard about Amy Schumer's plastic surgery disaster when she had botched plastic surgery? I heard about that too, and it immediately piqued my interest. Amy Schumer is one of my favorite comedians. She's wonderful. She's my age. She's a New Yorker. We've got a lot in common, and I wanted to know more about it. And then the more I explored, I realized that she did not have plastic surgery at all. There's no botched plastic surgery. She had a lot of fillers injected into her mid-face, and she was unhappy with the result and immediately got it dissolved. There's so much to dissect from this. I can't wait to tell you more about it. Stay tuned. Today I want to talk about Amy Schumer. She's a great New Yorker, a great actress, comedian, really an extraordinary person, and she recently made news headlines for having either botched plastic surgery or some sort of cosmetic disaster in her mid-face, where she looked like the so-called Maleficent, the character who has these big cartoonish cheekbones and a big jawline, because she had too much filler put in her face. So I got a little bit clickbaited by Perez Hilton when I was trying to figure out what was going on with her and what sort of plastic surgery she had. It's definitely piqued my interest. But no, there's no plastic surgery she had. She did have injectable fillers. What are fillers? Fillers are basically medical grade makeup. They are omnipresent. You'll see them on every single street corner. Every single med spa offers these products. These are biologic-like products. They are inert, and you can inject them in your face, your lips, your ears, anywhere, your butt. And they're made out of all sorts of substances. And the most popular type of filler is called hyaluronic acid. This is something that you find in joint fluid, and this is something that you can dissolve with a dissolver called hyaluronidase. And this is exactly what happened with Amy Schumer. She had volume put into her face. So let's start here. Why would a woman who's pretty, she looks great, but she's my age, so we're starting to show signs of aging, why would you volumize a full face? Amy Schumer is pretty, but she does have a full face, as you can see here. This is not an ideal patient for facial volumization. And so she went to a nurse practitioner who calls herself Dr. Jody Lo Gerfo, who dissolved this and feels like this is not necessarily an issue with patient selection, but it's where the filler was placed that's the problem. I kind of disagree. I think patients who have full faces should really strongly consider very selective placement of fillers. Places like the lips or the temples are areas where fat loss occurs with time. But the cheeks in an already full cheek, probably not the best idea. So what I take home from this article is, first of all, be very careful about placement of fillers in your face. I think fillers are a very important part of our practice here at my business, where we will do fillers as an adjunct to surgery. It is a great, safe way to volumize areas like the temples, prejowl sulci, the nasolabial folds, right here, areas where fat loss occurs with time. We can volumize it without surgery. It's brilliant. But it is not a replacement for surgery if you're having sagging, if you're having changes associated with gravity, age, and time. That's where we need to do some sort of tightening. The other thing is, when we continue to volumize the lower face in particular, it gives women almost an unnatural or masculine lower face. So just be very judicious with the amount of fillers that you put in your face. If you go to a med spa that is not associated with a plastic surgeon or doesn't have a good referral stream, be very mindful that if all you have is a hammer to work with, for example, everything's going to look like a nail. So the fillers are going to be the solution for everything, and it's going to be hard to turn a patient away who's asking for fillers. So the best thing you can do is either find a conservative injector who works nearby a plastic surgeon or in a plastic surgeon's office, so you know you have the luxury of that full array of services from augmentation to reduction. Because in a lot of cases, such as that of Ms. Schumer's, tightening and volume reduction would be the answer, not augmentation. Hopefully she's happy, she dissolved it, she looks great, but I think her lesson is very important for everybody, and I'm really glad to have the opportunity to present my take on this matter. So if you have any questions like this, do not hesitate to reach out in the comments section below. And by the way, if you want to watch more videos like this, please subscribe, like, let me know what you want to hear about. Every now and then something crosses my desk that I want to talk about like this, but there's a lot of other issues that people are asking about that I would be glad to answer as well. Thanks so much and have a great day.